Hello everyone. I present the paper in third International Conference on Data Science and Machine Learning Applications. My paper ID is 90. The title of presentation is a spectral clustering to detect prostate cancer using the multimodal images. We are three authors. Myself is Kiran Ingle, Pratibha Singare and Mangal Mahajan. So here I start the explanation of the abstract first. So my paper is related to the prostate cancer. So the prostate cancer is the second most frequently cancer in the men and is a fifth leading cancer death. At the earliest stage, the prostate are asymptomatic and do not require any care. However, if screened at early at stage, it can be removed immediately. So the prostate cancer screening is done either with the image modality like MRI and a TRUS. So here TRUS is nothing but a transrectal ultrasound imaging. This paper introduced a novel approach to demark the prostate boundary using the spectral clustering approaches with Gaussian similarity. The multimodal images database obtained with the ethically approved collaboration. The algorithm tested on 217 MRI images and 402 truth images, and the competency of approaches was evaluated with respect to the five equality methods in the both modalities. Here, the result shows that the proposed approaches is robust in demarking the prostate region with the segmentation accuracy 92.02% in MRI images and 93.70 images for truth images. The highest average sensitivity and specificity of 95.7% is segmenting MRI and truth images shows the robustness of the proposed spectral clustering algorithm. Second one, introduction. So as I discussed earlier, the prostate cancer is in the main means the prostate cancer is found in the male and is the fifth leading cause of the death worldwide. The prostate cancer are usually benign, begin with the no symptoms at the early stage and persist without any pain. However, the patient with the prostate may have the frequently urination, difficulty in urination, blood in the urination, hematospermia and nocturia. The advantage of this disease may persist with urinary retention and back pain. So the rate of incidence of the cancer varies among the continents and the general population. As per the epidemiology study of 2018, they reported nearly 1.27 million new cases of the prostate cancer globally. The incidence rate of the cancer is inconsistent across the globe. The incidence rate of the prostate cancer in Africa and Asia are 26.6 and 11.5 respectively. And Bhutan has reported lowest incidence rate at 1% only. Now, how to prostate cancer screen? Though screening of the prostate cancer is done initially using the prostate antigen test, digital rectal examination, and biopsy. The area of prostate is effectively seen in the digital rectal examination, which include the transrectal imaging called prostate ultrasound, or it is also called as the endorectal sonography. The volume of the prostate effectively seen in the T2 weighted MRI, which is used staging of the prostate cancer. Both of these tools have potential early detection of the cancer. The boundary of the prostate is very difficult to identify at the bottom, base and top of the prostate as the gland combine into the bladder and the pelvic floor respectively. The area and the volume estimate of the prostate region is subjective to the expert radiologist. The manual assessment leads in inaccuracy and many affect the treatment outcomes. So the lot of research has been done in the last 2 decades in the segmentation of the prostate, which includes the semi-automatic and the automatic approaches. The state of approaches reported aim at the combining various filters detect the prostate edges, then counters, shapes, models, and have the higher level knowledge. The hybrid semi-automatic technique by Mahadevi is currently the gold standard in the British Columbia, where they have used remarkable epidomical model by combining Kalman filter and edge detector to delineate prostate and measures of the value. Recently, the research have took advantage of worldwide database and at last published. The Norwegian group was the first try multi-atlas based segmentation technique to predict the prostate. Most of the segmentation methods uses the clinical mark ground truth images to compare the accuracy of the algorithm. The quality of the transrectal ultrasound image are affected by the speckle noise, showing shadowing and ultrasound reflection artifacts. The state-of-art literature has reported of various 2D and 3D prostate segmentation technique. Active counter and the snake have been widely used by many research groups to segment the prostate using the truth images. Recently, study have reported that the routine use of MRI prostate cancer is not advised as the lead higher grade cancer. It is also fact that the MRI and the truth targeted biopsy do not differ much in the terms of the cancer detection. The computer-aided diagnosis of the prostate cancer widely used for the detection. However, the segmentation techniques are inherently unstable at the periphery of the prostate. The cancer, the state-of-art deeply learning architecture are widely used for the prostate detection using truth images. However, these deep learning approaches are computationally expensive. So here we propose a spectral segmentation method, which is a robust and equally work on the truth and MRI images both. Since this method is conventional, it is not computationally expensive unlike the deep learning architecture. So next I explain the proposed methodology. So this is a proposed spectral clustering framework for the prostate segmentation with multimodal images. So the proposed method of the spectral clustering of the prostate with multimodal images is illustrated in the figure. The truth as well as MRI images are used for the segmentation. Both modality Images contain the speckle noise. So firstly, the speckle noises are removed by the application of local first order statistical filter. The filter images are used for further processing and the ground truth generation. Secondly, the spectral clustering is applied on the truth as well as MRI image simultaneously. The segmentation images, the segment, the segmented images by the is finally validated with the doctor mark and the rated ground truth image. So here these are the magnetic resonance image, transsectal ultrasound image denoising is compared with the ground truth, and we get the segmented image, prostate image. And the last, the statement of ethics. The study on the prostate image segmentation has followed the guideline of Helsinki Declaration and also biomedical research guideline issued by Indian Council of Medical Research. The study design is approved by the Ethical Board of Bharati Vidyapeeth Medical College Pune, Maharashtra, India. The study also contained the images taken from the publicly available database of MICCAI Grand Challenges 2012 with the copyright-free restriction. The next point is data acquisition and the description. So this is a figures. This is a numbers of the images. The axial T2 weighted magnetic resonance images were acquired by using 1.5 Tesla machine, and the images size obtained are in size 512 into 512 pixel. The 2D truth images were captured with the ultrasound images by using the ultrasound machine using curved transducer probes. The 2D truth images are size of 600 into 800 pixel. Nearly 40 patients were recruited in this study. The consent form was taken from the patient by briefing about the research. The briefing was done in the local language. The table number 1 shows the description of the database. The research involved 40 patients. So out of the 40, we captured MRI images and truth images. So number of images malignancy obtained in 140, 110 and V9 is 290 for the truth images. In the same way, in MRI images, malignancy occurs in the 70 MRI images and V9 are in terms of 147 images. The ground truth generated images are 402 for truth image and 217 for MRI image. The the most important point is noise denialation. The truths are affected by speckle and the motion noise. So reverberation, that is the spatial echo, is introduced in the image signal due to the multiple reflection producing delayed echo. The MRI images also suffer from the additive Gaussian noise. The denoising these three images to denoising these images is done using the first order locally applied adaptive median filter. These denoise images are used for the further segmentation of the prostate area. So here the approach, the spectral clustering based prostate area segmentation. So first, the segmentation involves partitioning the images into the prostate and non-prostate area. So putting the end data points in I dimension space to form the two cluster. Second one, define the graph with the finite and non-empty node as a vertex. After that, we define the edges. The fourth step is define the adjacency matrix. So here in the adjacency matrix, the Wij is the adjacency matrix, is belong to 0, 1 of the n into n dimension and is represent the edge set. So the edge sets are represent Wij is equal to Wji is equal to 1 and 0 if the vertex Vi, Vj belongs to E. So E is a set of edges, is belong to set of edges, otherwise 0. After that, determine the degree of matrix. After that, here we assume the two set A and B. The model local neighborhood with the Gaussian similarity function. So we set the function. This function is Sij, similar with exponential in bracket minus d of xi comma xj divided by 2 delta square bracket complete. And the last stage is the graph Laplacian matrix is constructed and defined by L njw is equal to d raised to minus 1 half ad raised to minus 1 half where ai is equal to 0. So this is the equation is in terms of the matrix form. So here after this is the algorithm, spectral clustering algorithm which we develop. The validation and the performance of the evaluation. We use this performance matrix to validate this research: accuracy, sensitivity, specificity, dice coefficient, and Jaccard matrix. Experimental result and discussion. So for this thing we use the performance matrix. Accuracy is defined by Tp plus Tn divided by Tp plus Tn plus Fn plus Fn. Sensitivity is Tp upon Tp plus Fv. Specificity Tn upon Tn plus Fn. Dice similarity coefficient Tp upon Tp plus Fn plus Fv, and Jaccard matrix 2 Jc upon Jc plus 1. So this is Tp is nothing but true positive, true negative, false positive, and false negative. Here the spectral clustering approaches for the segmentation. The figure shows some graphs. The spectral clustering images data points, the space representation. So this is the original image distribution. This is the similarity, and after segmentation we get such type of data. So here after segmentation, the spectral clustering on the truth images for the prostate segmentation. Though image A is the original image, this is the original truth image. After that we apply the additive median filter, and then the third image C is a doctor ground truth, and we compare this ground truth with our algorithm output, and lastly we get the segmented image. This is a MRI image. A is the original image, second is a filtered image, third is a ground truth, and lastly we compare, we get the segmented image properly. And the last, if you observe, this is the performance of the MRI segmentation. So here we achieve 92.02% accuracy. The Dias similarity is 81.2. The Jaccard matrix value is 87.6. the sensitivity is 95.3 and specificity is nearby 93.01. The same thing we achieved for the two truth images. We achieve 93.78% accuracy. Then dissimilarity is 87.6. After that, Jaccard matrix 81.2, sensitivity 93.01 and specificity 95.7. And this is the confusion matrix. So this is the heart of the this paper. By using the spectral clustering algorithm, we get the malignant patient 66, ground truth are 70, benign are 138, ground truth is 147. In the same way, for the truth images, the malignancy occurs by using the SA approaches is 102, the ground truth are 110. So here, out of the 402, 102 patients found cancerous, means malignant, and 270 patients found non-cancerous, means benign. So at the last, I want to explain the conclusion. We have proposed the robust technique to segment the multimodal images. Spectral clustering algorithm is tested. 217 MRI images and 402 truth images. Segmentation accuracy of 92% on MRI images. Segmentation accuracy 93.78 truth images. The highest sensitivity and specificity of 95.7. This spectral clustering shows the robustness of the proposed spectral clustering approaches. These are the references, and thank you.